So digital pathology is basically, as Varna has already explained, I'll just briefly tell you the introduction, it is enabled in part by virtual microscopy, which is practice of converting glass slides into digital slides that can be viewed, managed, and analyzed on a computer screen. This is basically what a digital pathology entails. And if you look at the value chain proposition, we were wondering, how do we go about creating value in digital pathology? Then I thought it could be easily divided into 4 different areas. One would be the educational empowerment and improvement in educational services, thus improving the quality of the pathologies that are coming out. And second would be in the area of improvement in diagnostic services, where we can differentiate in Apollo hospitals by providing subspecialty or super specialty diagnostic services. And third would be the area of provision of high quality reporting to far reach areas where services are limited or experts are not available. And fourth, and the more exciting area that is taking the digital pathology world by storm, is research related activities relating to computational work and artificial intelligence applications. So these two would not have been possible if digitization was not made in pathology. So I thought my next speaker is going to deal with education in much detail. So I'll just breeze through these slides in the interest of time. So education, anytime you ask a student what a pathology slide means, he says, "Madam, I diagnose it based on a small corner broken slide as a melanoma." That's not the way to diagnose a pathology. So you have to actually learn it and create interest in students. So when we make a digitized image, it can be beamed on a larger screen. We can annotate it, provide questions, and make exam slides. Macroscopic images can be added, and we can also add other multimedia and improve the patient's, the student satisfaction, and make learning more fun, I would say. So when people understand pathology, when students understand pathology, interest in pathology also grows, and thus enrollment also will increase. And here I cannot have a pathology lecture without a digitized image. Here is one of the slide I'm showing you here is a section of a digitized image. I took a photograph. It can highlight a key feature. This is a tumor from a 4-year-old child that was present in the cerebellum. And here we see a feature which is most read about but hardly seen, what we call as Rosenthal fibers. So I can highlight and show to here like this. So this is what a Rosenthal fiber looks like. But this is not possible on a traditional microscopy, where we see through a small image is seen through the microscope lens, and it is difficult for people to understand what exactly we are saying. That's one of the reasons why people don't find so much interest in histopathology, because it requires a lot of learning and understanding. But if we make it easier, I think people will gain interest, and it will also improve our understandings in histopathological diagnosis. So how we can change this? So we can change the education in the form of taking the digital pathology, creating a digital classroom, and create a digital modular learning, where either we can go to the class sitting in our tables, we can go to the class through web means and teach from our sitting area in our offices. So what I typically like to call it as digital classroom. And digital modules can be created for pathology, where individualized learning, or a group of people who want a certain area of pathology, only niche areas that need to be studied, we can create modules catering to the students' needs, and it can be made available at the privacy of their home or whenever they get some time. So these are the ways we can segregate the education in the form of classroom, digital classrooms, as well as digital modular learnings, which can be made available and on the personal learning stage, at the end of which exam course can be conducted, and we can improve, provide services in enhancing knowledge. Sorry about that. So the third area this is where I want to focus a little bit, and we are going to differentiate in Pathology Network Apollo Hospitals Group. This is going to be a key feature. So diagnostic services through digital pathology, we can provide subspecialty pathology services and practice. We have already identified, the process is already in place, and why it is possible in a network of Apollo Hospital, because we are a huge network and we are connected through a single network where all the digital material is available, and so that we can just share the file, the access to these images is going to be very easy. So I can, sitting in Chennai, can send a case to in Hyderabad to review a case for Swarna madam, who is a nephropathologist. If I have a case, I tell her I can share. I said, or I can tell her to take over the case, please. It's difficult for me, and can you sign out the case? So these are the requests in arena of patient care will be improved, and also it gets the deserving pathologists who can make justice to the case. So direct case reviews and reporting services can be envisaged. Or you can also provide assistance to a primary reporting pathologist who has difficulty in certain areas of a common tumor or a common lesion, where we have to make sense of these atypical features and then call the case. So this is an expert can come into picture and assist the primary reporting pathologist and help draw meaningful conclusions. And we can put both of our names and say we have reviewed the case and give a patient benefit of an improved diagnostics. And what this does is that overall there is improvement in diagnostics, and thus it will help refine patient care. So what are the benefits that diagnostic services provides through digital pathology getting expert opinion? So one, the slides reach the consultant pathologist fast, within minutes to hours. Okay, and the final report can be obtained within a very short period of time, as soon as a day, from any country or in the world, anywhere it can be reached. Multiple consultations can be obtained at the same time by sending the image link to many pathologists simultaneously. So we can have, if there is a discordance between two pathologists, it can be shared to a third pathologist to come to a conclusion. So this is a very useful feature. You couldn't have done this if digital pathology files are not created through digital imaging. And anxiety period for the patient and the family is also markedly reduced. One, time is reduced. Second, they know and they have a confidence that there's more than one set of pathology eyes have seen the case, and we have maintained accuracy, and we have rendered a correct diagnosis. And most importantly, there is no risk of losing important case material during transit time and transit delays, where the material reaches to the consultant and reviewed. And thus, these are the major benefits where we can get expert opinions and offer super specialty reports by super specialists and diagnostics, improvement in diagnostics. And I would like to take the digital pathology to another area of where we can create value. So digital pathology in remote reporting. Okay? Digital pathology applications generate what we call it as a whole slide image, WSI. Okay, which can be accessible in any remote area. If you have internet, high-speed internet access and the link to the case, you can easily access this image and you can render a report. For example, for any reason I'm not able to come to the hospital, I can access this image from home and generate a report without hindering the patient care. And especially in COVID times, this has come as a boon to us, actually, where transportation was stopped. We couldn't send the slides anywhere, so we could easily share the files and get an expert opinion. And sometimes doctors go on long leave, pathologists, and they're not available in their offices or at the site to provide services. In such cases also, accessing through VPN networks, we can do digital remote reporting. And in last area is that we can provide diagnostic services or where experts are far reachable or don't exist. For example, a remote corner of India, where if we were able to have a digital scanner, the slides can be digitized with little effort, and the files can be shared to wherever the experts are located, and we can sit here and in the comfort of our office, we can generate a decent pathology report for a patient or for a institution that is remotely located. This can be applied, as Dr. Hari Prasad earlier reiterated, that we can go to even other countries who don't have a diagnostic services or a good pathology practice. They can get a scanner, get the images scanned there, and they can be beamed to us, and we can give quality reporting from another country or for a remote region. And that is where I find digital pathology applications finding most use. Ease reaching for any corner of the globe and providing expertise in digital pathology services, subspecialty specialization. So this is another area where digital pathology can generate value. So next and most important field right now that is abuzz and drawing everybody's attention is the digital pathology and computational world and artificial intelligence applications. So I'll just brief you what exactly is computational pathology. It is analysis of digitized pathology images with associated metadata, typically using artificial intelligence data, which includes deep learning. Deep learning is a form of artificial intelligence method where machine learns to perform a task based on examples. So these two go hand in hand. But if this has to happen, there is a very key component that has to be present, and that is the component of digitized images, where algorithm learns by extracting important histology image features and automatically from examples. A good way to do that is to create a really good archives and a large repository of digital images, especially for tumors and rare diseases. So which brings us to a genesis of Apollo Pathology Image Archives, what I would like to call it as APIA. So we have scanners around 5 major cities already, and the amount of images that each institution can generate is humongous. Okay, and so this is the key component in artificial intelligence and computational pathology applications. So if the images are large in number, and the algorithms can become robust when there is a data collected from a large array of slide imageries. So how it does? So first we have an input image where there is a slide is chosen, and we segment the slide for key features, okay, which are fed into the system, and algorithms are written. So the output slide will tell us what is a normal, what is an abnormal slide. So the robustness of the algorithms and the prediction that they make depends on the number of images the data is applied. It's all about numbers and numbers and numbers. This cannot be achieved unless until we have a large archive. We need thousands and thousands of images. For example, we need to have 20,000 images of a colon cancer before we can annotate, take into all the heterogeneity aspects, and then create algorithms which can be robust enough in creating prediction values. So the heart and the core of computational analysis is the presence of digital libraries of pathology images. So we at Apollo Hospitals are very well poised to do this, because we have a huge network, very vast network of hospitals that are now going to be in one chain, and a common image data or archives can be created, so which can be used for computational activities. So what are the applications now? So we got the algorithms and what we can do with it. So there are myriads of applications, and a lot of papers are coming right now in digital pathology journals that can tell us. One of example I have given here is computational pathology can be used in analysis of tissue microarrays to predict the renal cell cancer survival in carcinoma patient. On left hand side is the survival graph or the prediction graph by a pathologist. And on the right hand side is the algorithm derived by this is the graph derived by the algorithm. As you can see, the right hand side produces a much better algorithm and slightly better than what was done by humans or a pathologist drawing the algorithms. So we can use it in multitude of ways, and it will enhance or transform the patient care. Another area where we can use is the computational pathology on automated Gleason's grading using deep learning in prostate cancer. So there is so much of inter-observer bias that a pathologist will give it as a grade group 3. The same goes to another pathologist, they can call it as grade group 4. This provides a lot of confusion to the pathologists, which clinicians, where to go now, how to put treatment, whether to go with 3 or with 4. So the inter-observer bias can be significantly reduced with automation and deep learning. And this is one area that can be very helpful through deep learning and computational pathology. And here is how it is done. So initially what we do is semi-automatic data labeling is done. We collect a large slides and see all the features which are annotated and then fed through the data algorithms which collect the data, and then refinement and training occurs, and then grade group prediction has been refined. So the larger the image, larger number of images are examined, the better will be the quality and outcome of these algorithms. So they become more accurate in prediction. So this is another area. So how we can use in breast cancers, we can use digital pathology in diagnostic assessment of using deep learning algorithms for detection of lymph node metastasis in women with breast cancer. We can predict which patients with DCIS are going to develop recurrences. So there are a lot of research labs that are going around the world that are trying to apply digital pathology based computational algorithms for making prediction models and trying to improve the diagnostic skills, and thereby improving the patient care. So what does this mean? Does AI replace the need for pathologists? AI does not replace the expertise and experience of a pathologist. The software and deep learning applications provide pathologists with data and insights that could not have had using traditional microscopy. It helps in reducing the inter-observer bias, and accuracy is enhanced. This is where digital pathology through computational analysis and artificial intelligence is changing the way we are doing diagnostics, and paradigm shift is occurring. So these are the various realms where digital pathology can generate value. A person today who has the largest number of images in the library are the ones who are sitting on data mine. This is a gold mine where it is a fertile ground to do very effective research based on computational pathology. So we as a group are very well poised to do remote reporting, subspecialty services, educational improvement, and for future research. So these are the 4 areas where digital pathology can play a significant role and create value for us. And we are already in the process. We have some research going into it, and we have some ideas how to take the digital pathology forums and create modules for learning. And that's all in process. Very soon we will have it in our network. And this is the advantages of having digital pathology and its applications. So with this, I'm going to conclude my